Hello, and welcome back to Ethna Care's channel, where we believe knowledge is power. And as we usually do, today we'll take another topic. I will go through it together so that we can learn. And I'll ask you to please subscribe to the channel, share with others, and please like our videos and make sure you're learning. Our topic is the things you should know about menopause. So we'll be taking 12 different points to note about menopause, whether you're already in that stage or you're just trying to share with somebody who is in that stage. You have to learn one thing or the other. All right, so what is menopause? Yeah. When you have not had a menstrual period for a time frame of 12 months, then we can safely say that that is menopause. And it usually depends on the age, uh, because it's different from one person to another. It can start in some people as early as the early 40s, the late 40s, into the early 50s, and all that. It's actually in stages, and we'll go to the different stages, different ages in the life. And the women that are past certain age, um, they should be preparing for menopause. So it can result into a lot of changes in the body. The main symptoms are the reduction in the production of the hormones, estrogen and progesterone in the ovaries. Those hormones are very important for the menstrual cycle, but at a certain point towards the end of the reproductive life cycle of a menstruator, the production of those hormones begin to reduce in the ovaries. And the main symptoms of that include the hot flashes, weight gain, and vaginal dryness, you know, vaginal atrophy, which is the inflammation or thinning of the vaginal tissues. Okay? And that adds to the vaginal dryness and contributes to uncomfortable intercourse. And that's why at that stage, some people claim low libido because intercourse can be uncomfortable. Of course, that does not say it is the end of having sexual intercourse with your partner. So it also increases the risk of certain conditions like osteoporosis, um, and so, because of these symptoms, you might be needing medical attention at that stage, and you might want to make your gynecologist, your doctor, your friend, if you decide you need to discuss your symptoms or your treatment options with a doctor. All right, so that's having said that, we move to our second question. What age will I be when I go through menopause? The average onset of menopause is 51 years, and many women stop having periods anything between ages 45 to 55. So for those people who start menopause around 40 years, those people are said to have premature menopause. And it's early if it's around 45 years. Yes, that's early menopause because on the average it's about 51 years. But before the 51 years, before the average, when it stops eventually, there's what is referred to as perimenopause, where you'll be experiencing some of the symptoms of menopause. But of course, the period might cease for a while and then comes back again, just telling you that menopause is setting in gradually. So, and many others, even into their late 50s, will still continue to have their menstrual periods. So the age is actually thought to be a genetic thing, but there are certain things that can accelerate ovary decline, where the production of the hormones take place. So such things include smoking and chemotherapy, and that can result into earlier menopause. Okay. Our third question is, what's the difference between perimenopause and menopause? Okay. Perimenopause is the period of time just before menopause begins. During perimenopause, that's the time when the body is beginning the transition phase into menopause, and that means hormone production begins to decline, but doesn't stop outrightly. And you may begin to experience some of the symptoms that are commonly associated with menopause. And such symptoms include things like hot flashes. And of course, like I said earlier, the menstrual cycle may become irregular, but it won't cease during the perimenopause stage. So once you are no longer experiencing the period for a time frame of 12 months, that is a year, then you can actually say you have moved from perimenopause to menopause. Okay, so what are the symptoms caused by the reduced levels of estrogen in my body? So many women, about 75% of people at that stage will experience hot flashes during menopause. And hot flashes seems to be the most common of the symptoms that will be experienced by menopausal women. It can occur during the day or at night. And some people also experience muscle and joint pain that is known as arthralgia. Some experience mood swings. The symptoms could be both physical and psychological. Okay. And at times, some of these symptoms could also be associated with shift in hormones, life circumstances, stress, or aging process in itself. So you have to understand whether it's as a result of menopause or other life circumstances. And that's why, like I said earlier, your doctor is your friend, especially at this stage. The fifth question says, when do I know that I am having a hot flash? Okay, so we're actually going to be looking at the signs and symptoms of hot flashes. Okay, because during a hot flash, you actually experience a rising temperature. It affects the top half of the body, and the skin may even turn red in color and become blotchy, and the rush of heat can lead to sweating, heart palpitations, and feelings of dizziness. And then after the hot flash, there is this the rapid heat loss that results into cold. You feel cold. So at times it comes daily or even multiple times in the day. It could be in the morning, in the afternoon, or in the evening, and then you experience them over the course of a year or even several years. Um, all you need to do is to avoid the things that trigger the number of hot flashes that you experience with you begin to notice the things that can trigger them in you, and some of the triggers include consuming alcohol or caffeine, eating spicy food, feeling stressed, um, being somewhat hot, being overweight, and smoking. So how do we to prevent hot flash? All we need to do is to reduce the triggers as much as possible or to avoid them. Um, for example, reduce the level of stress, and then you can also avoid eating spicy food as much as possible or reduce it. So yeah, to reduce all other things you need to do to reduce the hot flashes includes dressing in layers, okay, and using a fan in your home or office space. Okay, then you can also practice breathing exercises during the hot flash to minimize the impact of the hot flash. And then we also have some medications that can help to reduce the impact, including things like birth control pills, hormone therapy, or even other prescriptions from the doctor. So if you're having a lot of difficulty managing the hot flashes on your own, please see your doctor. moving to the sixth thing, and that's about halfway through. And please don't forget to subscribe to the channel. The link is there below. And you can also check the channel for more videos on a lot of topics that we have discussed previously. All right, so number 6 says, how does menopause affect my bone health? Yeah, um, the decline, the reduction in estrogen production can affect the amount of calcium in the bones, and you know that calcium is important for building up the bone density. And so because the amount of calcium reduces, there's a significant decrease in the density of the bone. The bone becomes less dense and more susceptible to different types of fracture, including the hip fracture, spine fracture, and other bones in other parts of the body, fractures in them. So many people usually experience accelerated bone loss in the first few years after their last menstrual period. So to keep our bones healthy, even in that stage, you should eat food with a lot of calcium such as food with dairy products and dark leafy greens. They help to supplement the calcium, and we can also take vitamin D supplements, regular exercise, including weight training, should be part of the exercise routine, and then we should reduce alcohol consumption as much as possible and avoid smoking. Okay, and there are also prescription medications, but you may want to discuss with your doctor on which one suits you better. So, the seventh question is the heart linked to menopause? Yes. There might be certain conditions related to the heart that can arise during menopause, and that includes dizziness or cardiac palpitations. Um, the decreased estrogen levels can prevent the body from retaining flexible arteries, and this can impact blood flow. So it's very important that you watch your weight, you eat healthy, adequate, balanced diet, exercise, and not smoke to reduce the chances of developing heart conditions. Yeah. So many people also want to know, will I gain weight when I experience menopause? Yeah. The changes in hormone levels can result into an increase in weight, and also aging can also contribute to weight gain. So the focus should be on maintaining a balanced diet, regular exercise, and other healthy lifestyle, healthy habits, because being overweight can increase the risk of heart disease and other diseases like diabetes and so on. So to manage the weight, we can do something like healthy lifestyle, okay, including your food, your exercise, um, your the habits, the good life habit, the healthy life habits, um, not smoking, not taking alcohol, reduction in the level of caffeine you take, and watching the kind of food you eat. All right, so we'll move to the ninth point, and that's talking about, will I experience the same symptoms as my mother, sister, or friends? You know, we earlier said that menopause can be genetic. Okay, it's usually genetic. So the symptoms may vary from one woman to another, even those from the same family. The rate and age of decline of the ovary function actually differ from one person to another. And you might have to manage your hormone menopause individually. That means what works for your mother or your sister or your friend might not work for you. Okay, and that's why you need to talk to your doctor if you have questions about menopause or the symptoms you are experiencing. Our next question says, how will I know if I'm going through menopause if I've had a hysterectomy? Okay, hysterectomy is the surgical removal of the uterus, and in some people, it could be a total hysterectomy where the whole uterus is removed. It can be a partial hysterectomy where only some part is removed, or it could be radical hysterectomy where the whole uterus and the whole reproductive system has been removed. So estrogen levels decrease after a radical hysterectomy, which causes hot flashes. So if you have also had the condition called endometrial ablation and your ovaries were not removed, the the removal of the lining of the uterus can also result in heavy menstruation. Okay, so um, that's one of the causes. And if you're not having any symptoms of menopause, you can actually get to the doctor where they conduct a blood test to determine if your ovaries are still functioning or not. And this test could be used to help doctors to find out about your estrogen level. And this is especially beneficial if you're at risk of osteoporosis. So they might want to use it to determine whether you need a bone density assessment or not. Yeah, well, gradually moving towards the end, and the 11th question we're answering about menopause is hormone replacement a safe option for management of menopausal problems? You know, because there are many hormone therapies that have been approved by the Food and Drug Administration, the FDA, for treatment of hot flashes and prevention of bone loss. There are so many benefits to it, including relieving the symptoms of hot flashes, relieving the symptoms of mood swings, and vaginal dryness. Uh, but there are also risks attached to it. And such risk could be things like strokes and blood clots, breast cancer, endometrial cancer. And so because of the risk and the benefit, you have to talk to your doctor before trying hormone therapies. It's not an over-the-counter thing. It has to be recommended. The doctor must assess your health and must be able to weigh the benefit and the risk and determine if you are personally able to take such hormone replacements as a way for managing your menopausal problems. Okay, and of course, apart from hormonal options, we also have non-hormonal options for management of menopausal symptoms, and that usually includes lifestyle changes such as weight loss, and regular exercise helps a lot with that. Room temperature reductions to help with the hot flashes, then avoiding foods that can aggravate the symptoms, and also eating foods that can help to reduce the symptoms like soy and so on. And of course, dressing in light cotton clothing, and you can also wear clothes in layers, but not overdressing, so as to help with the hot flashes. And we also have treatments such as the use of herbal therapies, okay, acupuncture, and certain low dose antidepressants and other medications can be useful in decreasing hot flashes. Looking at, okay, some of the FDA approved medications that can be used for prevention of bone loss, and they include things like biophosphonates, um, including risedronates, Actinel. I will not even go much into this. However, please know that some of them can be found over the counter, and estrogen creams and products like that can also help with vaginal dryness. So, yeah, to get to the point, the interesting parts where I like always, that's where I get to give you quick tips on the chosen topic. So today we are going to look at the myths and the facts about menopause, because there are so many myths going around. Some people believe that menopause begins at 50. The fact is that menopause has a range, a age range, and you may not tie it at 50. The average is 51, but it might begin from anything around 40 to 58 years. And there's also the myth that with menopause, there's no more sex life. Well, I'll say you can still have sex, but there is decrease in the libido, and also because of the vaginal dryness, so many people find having sex uncomfortable, but you can be able to find a way around it if you have the discussion with your um, partner. And there are also some creams that you can make use of to increase to lubricate, to reduce the dryness. Okay. Another myth is that menopause is a disease. Come of it. Menopause is not a disease. It's a natural condition. It's a stage. It is the end of the reproductive phase. Reproduction in females is part of the secondary growth that takes place in females, especially even in males. But for females, there are distinct things that happen at that time. So part of it is the onset of menstruation. Okay, so at the end of that cycle, which is the time at which there is a cessation of the menstrual cycle, is what is known as menopause. So menopause is not a disease. All right. So another one of the myths is that weight gain is inevitable. Well, weight gain can be prevented with the right food choice and regular exercise. That means you can take lifestyle, you can maintain lifestyle that will help you to manage your weight. Another myth is that hot flashes is the first warning sign. Well, it might be in some people, it may not be in some people. It's just that a higher number of women tend to have hot flashes. But there are other signs and symptoms, and it comes in randomly. You cannot put it like until I have hot flashes. So don't wait for hot flashes alone. It could be the sign you will have. You may not have that. You may have others before the hot flashes. So it could come in randomly. And manifestations, that's another myth, that the manifestations are physical symptoms only. No, there are both physical symptoms and psychological symptoms, and it needs to be managed very well. And also, we also have the emotional impact, in women. So all of these parts, the physical, the psychological, and the emotional, needs to be properly managed to be able to fight through that period of time. So what's our takeaway for today? Menopause is a natural part of a woman's life cycle. It's the time when your estrogen and progesterone levels decrease. There was a time the production increased, and this is the time when it gets to decrease. And after that, you have higher risk of certain conditions like osteoporosis or cardiovascular diseases. And so you need to manage your symptoms very well and maintain a very healthy diet, get plenty of exercise, and avoid unnecessary weight gain. And much more importantly, contact your doctor if you experience adverse symptoms that may affect your ability to function. And if you notice anything unusual that needs a closer look, your doctor is your friend. Okay, there are lots of treatment options, and that can help you with whatever symptoms you are experiencing. So please do not hesitate to talk to your doctor. And that's where we come to an end of today's class. um, so thank you so much for watching, and don't forget to subscribe to this channel. Don't forget to like our page and share with others. Thank you.